Hello friends, welcome to Forensic Medicine by Dr. Paras. And now we are going to discuss about chapter number 10, that is all about the mechanical injuries. So first let's classify the mechanical injuries into three parts. What are that? Blunt force trauma, pointed end and the sharp force traumas. So these are the three type of traumas we are having. Blunt force, sharp force trauma and the pointed end injuries are there. In the blunt force trauma, what we are having, sir, we'll get a fracture. If there is a, what is blunt force actually? If someone is hitting you like this is blunt force. This might can end with the fracture, my dear friends. This might can break the bones, etc. There can be an abrasion. What do you know about the abrasion? Abrasion means the skin is gone, the epidermis is gone. Epidermis absent. Abrasion is all different type, pressure abrasion, then there will be a grazed abrasion, scratch abrasion, different type of abrasions we are going to discuss. Third thing is laceration, lacerated wound. There will be a laceration, all the layers are breached, all the layers are breached. All the layers are breached. This is laceration, my dear friends. Now we talk about the other thing, that is contusion. What is contusion? Contusion, the skin is intact. Skin is intact, but there is a ecchymosis. That means collection of blood under the skin. So what can happen because of, if I take this object, if it hits here, my dear friends, there will be a fracture of shaft of humerus. There will be abrasion because it hit like this. There will be skin peeling. If the skin is intact, there will be a blood which will be collected because of the blunt force. If the edge of this object is hitting me right here, if the object is hitting me right here, then there can be a laceration also, where all the layers are gone. On the second side, if we talk about the pointed end is like this. If you see my pencil right here, this pencil is having the pointed end, or the object you have seen just to cut the piece of ice breaker, you can say, that is stab. And stab is like this. You are stabbing someone with the pointed end. This would lead to a stab wound. Stab wound, there will be entry and exit. There will be entry and exit. Entry of stab wound would be large. Exit would be small. Exit would be small, my dear friends. Then sharp force trauma, if we talk about, there will be a chop injury. And chop injury is done by axe. Axe will do what? It will cut the skin, and along with the skin, it will cut the bone also. If along with the skin your bone is also gone, then that type of injury is called as what's a chop injury. Incised wound. Incised wound you will see with the surgical blade. Surgical blade. When you are giving the incision onto the skin, you will see there will be an incised wound. Incised wound. Incised wound. So these are the type of forces and the type of injuries you are getting from the individual type of force. Now we'll be talking about all these things one by one. If we talk about the abrasion first. So abrasion, only and only epidermis is gone. Only and only epidermis is gone in the abrasion, my dear friends. All the other layers are intact. Only epidermis is affected. All other layers are intact. All other layers are intact right here, sir. Now coming to the type of forces. Sir, there will be a tangential force. Tangential force is coming like this. If I draw the surface, if I draw this table, so tangential force will be like this. Like this. Like this. Tangential pressure force is there, pressure abrasion. So in tangential, the example would be scratch or a graze, my dear friends. Scratch can be with the nail, can be with the thorn, can be with the needle. Graze is most commonly seen in the road traffic accident. A road traffic accident is there and you will be rolling onto the ground and you will see your epidermis is scraped off because of the tangential pressure abrasion. Second is perpendicular pressure abrasion. Sir, if I draw again right here the table, perpendicular force would be like this, my dear friend. Perpendicular force would be like this. If this is the case, then there will be a pressure. You can see the direction of the force. There will be pressure. Because of pressure, there will be a pattern of the object which you are using. The pattern would be there of object you use. Example, rope. Example, we use the rope, my dear friend. Example, we use the rope. Now, let's learn one by one with the help of diagrams and beautiful examples. Tangential pressure abrasion, we talked about the force is like this. Tangential force. First thing is scratch. You can very well see here the scratch marks right here, sir. This is a type of abrasion. Here you will see what? Your epidermis is gone. What do you see here, sir? Epidermis. Epidermis is absent. And later on there will be a scab formation. It can be with the pin, thorn, nail, etc. What is the medico-legal importance? Guys, if there is a scratch on the face, if scratch is there on face, that means fight happened. And also, if there is a homicide, if there is homicide, you will see the victim scratching skin of accused. And in post-mortem finding, you can see skin of accused in the nails of victim. You can see the skin of accused in the nails of victim. So many medico-legal importance are there, my dear friends. Scratch is done. So if we learn in scratch, there will be a tangential force. Next is grazed abrasion. Grazed abrasion, also known as sliding abrasion or brush burn. Why we call this brush burn? If you will see there, multiple scratch lines are there and they look like the burn has happened. And here also epidermis is absent. Most commonly seen with road traffic accident. Road traffic accident. Medico-legal importance. What is medico-legal importance? Medico-legal importance, guys, remember. Medico-legal importance. If someone had a road traffic accident and someone is saying that the person died because of the road traffic accident, but on the body there is no abrasion, no grazed abrasion, my dear friends. That means the history is not matching the actual scenario. That means the person who is telling you the story, he is lying. So in this way we can use the knowledge in the forensic medicine, evidence collection and the report making, my dear friends. So medical legal importance of grazed abrasion, you can see this in road traffic accident patient. This will not clearly mention that whether this is murder or something like suicide, nothing like that, but yes, it can tell whether the road traffic accident was there or not there because the pattern of injury you will see. So this is all about the grazed abrasion, my dear friends. Now coming to the perpendicular pressure abrasion like this. So perpendicular pressure abrasion, if we talk about, sir, perpendicular pressure abrasion, crushing of epithelium is seen. Now epithelium is crushed. For example, ligature or the bite mark. Ligature mark or the bite mark. If I can show you, this is ligature mark, my dear friends. This is what, sir? Ligature mark right here. So this ligature mark, you can very well see this ligature mark is below the thyroid. That means what? Below the thyroid, that means manual strangulation. Has happened. Manual strangulation has happened, and if you can see the ligature mark is what, sir? Transverse. If the ligature mark is oblique here, ligature mark is oblique here, then we would have notice that this is a case of hanging. Then we would have seen that this is a case of hanging, my dear friends. Then hanging, it is above thyroid, and hanging, it is above thyroid, and hanging, it is above the thyroid, my dear friends. Understand? Now other thing is pattern abrasion, and also I was talking about the bite mark. Bite mark is example of pressure plus pattern both. Why pattern? Because you will see teeth pattern, teeth mark. That will make pattern also. Pressure and pattern both, my dear friends. Now pattern abrasion, if you see right here, sir, crushing of epithelium, sir, plus pattern of abrasion is seen. That means you can easily find out with which object the pressure was there. So you can see ligature mark or object mark, like this belt buckle is there. So this belt buckle, you can see it is making the mark here. Now your upper epithelium is crushed, plus there is a collection of blood. Crushed epithelium plus collection of blood will be telling you about the object used. Object used, my dear friends. So these are the important things you need to learn about the abrasion. Now abrasion, there will be a scab formation. To learn the scab formation in the abrasion, my dear friends, we have to remember these steps. It will help us to calculate the time since death, time since injury, not death, my dear friend, time since injury. So there is a very famous and special mnemonic for all of you, my dear friends. RB. So very simple to remember. RB. R for raw. If the color of the scab is raw, my dear friends, the time since injury is less than 12 hours. If the color of the scab is reddish scab, my dear friends, then the time since injury would be 12 to 24 hours. More than 12 hours, less than 12 to 24 hours. If reddish brown scab is there, then remember it is 2 to 3 days, reddish brown. And if it is brown, then 4 to 5 days. If black scab is there, 6 to 7 days. After black, what will happen? Normal skin regenerate under the crack. There will be a scab formation, guys. RB, R for raw, less than 12 hours. Then reddish scab, 12 to 24 hours. Reddish brown, 2 to 3 days. And brown, 4 to 5 days. And black, 6 to 7 days. I hope this is very much clear to all of you. Now coming to the manner of death. Manner of death, guys. Abrasion in the perioral region If abrasion is there on the perioral region, that means smothering has happened. What is smothering? The word smothering means closure of, forceful, yes, forceful. Now here it is forceful closure of nasopharynx plus oropharynx. Forceful closure of nasopharynx plus oropharynx is there in the smothering, my dear friends. And it can be done with the help of hand, and it can be done with the help of other objects also. If done with the hand, you will come to know there will be a pressure marks over there, and there can be a grazed abrasion you are going to see. The nail abrasion over the neck will suggest you of a throttling. If you are killing someone with your hand on the neck, throttling means hand on neck. Now my dear friends, two type of pattern you can see. One is six-penny, another is butterfly. Six-penny and butterfly. If you are using your 5 fingers and you are just pressing it till the epithelium is crushed, it will lead to six-penny. There will be bruise formation also, plus there will be a scab because of the grazed abrasion. Plus butterfly is with this part, or any object you are using and you are compressing that object onto the neck. This will lead towards a butterfly, right here, sir, butterfly. So nail abrasion is also, this will tell you the manner of the death, my dear friends. So abrasion in the perioral area is smoothing, perioral this area, smothering we'll call that, and if it is on the neck we call that as throttling. Throttling is done with the help of hand or any other object which can compress your neck, my dear friends. And other thing you can add right here is strangulation. This is again neck compression. Strangulation is again neck compression. You can use rope here. You can use the sticks here, Barnes Dola. Garroting is there where you use the metallic collar. So different things are there you need to remember right here, sir. Now what are the medico-legal importance of the abrasion? Sir, you will come to know about the pattern of weapon. If the rope marks are there, if someone killed you with this wire, so you will come to know the mark of the wire. Big wire, small wire, rope, non-rope, whatever it is, you will come the mark on the force area. Second thing is you will come to know about the direction of the force. From where the force is. If it is on the back side, I am just taking one example. If this is from the back side, you will get to know pattern on the back. If it is force from the back, you will get to know the pattern on the front, my dear friends. Same is with the blunt force. If I am using this and hitting it this side, you will come to know from where the force is. Then it will tell us the time since injury. How will come to time since injury? Just now we have read, sir, RRRB. That is RR. How to come to know time since injury? RRRB BB. RRRB BB, that is raw, that is reddish brown, then black. Less than 12 hours. 12 to 24 hours, 2 to 3 days, then 4 to 5, 6 to 7 days. Most significant medico-legal wound is abrasion. Most significant medico-legal wound is abrasion. With abrasion, you can find many things. Many things are associated with the abrasion. Pattern, type, force, from where it is coming. Anything can be found with this help of the abrasion. If abrasions are present, you can interpret many things in the postmortem or in the person who got the assault, my dear friends. So these are the things you need to remember here. Now we will be shifting on to the next topic. Before shifting the next topic, we will be revising what we have studied just now, sir. So if we talk about the classification, we classified into 3 parts. What are the 3 parts we classify? Blunt force. In blunt force, what can happen, sir? Just now we have revised all the blunt force. What is blunt force? Blunt force, there can be a fracture. There can be abrasion, there can be laceration, there can be a contusion. Then we talked about the pointed end. Pointed end, there will be a stab wound, sharp force trauma, chop injury, incised wound would be there. Now type of forces are there, two type of forces are there. One is tangential force, other is perpendicular force. Moment there is a tangential force, my dear friends, there will be scratch and grazed abrasion. Moment there is a perpendicular pressure, my dear friends, in perpendicular pressure you will see pattern abrasion and pattern abrasion and pressure abrasion, my dear friends. Then we have studied about different medico-legal importance, my dear friends. If we talk about the medico-legal importance of this, so guys, remember pattern of weapon, direction of weapon, time since injury, and most significant wound would be the abrasion in the medico-legal importance, my dear friends. Now we'll be moving on to the next topic. Next topic is contusion or the bruise. Contusion or the bruise. If we see right here, sir, contusion or the bruise, the mechanism of action is blunt force. There will be a dermal vessel rupture. If this is skin, under the skin there will be the vessels. There will be the vessels. These blue are the vessels. So moment there is a heavy blunt force right here, sir. Skin is intact, but these vessels got injured, and after injury the blood started leaking out. The blood started leaking out, and that blood got collected just under the skin in this area. This is nothing but called as extravasation. Away, outside from the vessels, that is extravasation. Extravasation of the blood. Extravasation of the blood. Now swelling plus discoloration of the skin with the irregular margins. If someone asks you what were the margins, your answer would be irregular margins would be there. What would be there, sir? Irregular margins would be there. So what is the mechanism? There is a blunt force. For example, if I take this, there is a blunt force. Because of blunt force, you will see skin is intact this time, but the vessels which are under the skin got damaged. Because of the vessel damage, now the blood is pooling outside and they are getting collected under the skin. And there will be a swelling, discoloration of skin with the irregular margin. So let's learn different things, like this is example. This is example of what's your contusion. Our contusion is also called as bruise. Contusion or bruise. You can see the skin is intact. Skin intact. Margins irregular. Irregular margins are there. Margins are irregular right here. Now let's learn about the factors that are influencing the appearance of the contusion. First of all, site. If we talk about, if there is a bony prominence, my dear friends, bony prominence, example forehead, head, example elbow, there will be a increase in bruising, because little amount of force can produce bruise there. A small amount of force can produce bruise here. It's very easy, because there is no muscle mass to absorb the shock. Directly vessels would be hit, and direct hitting of the vessels can lead to the extravasation very, very easily. So first factor is a site. If the site you have to remember, you should remember the site is the bony prominences, that is your forehead, elbow, shin also it is included, shin. These are the common areas where most commonly it can happen because of the skin and the vessel direct contact. Now coming to the second factor, age. If we have to talk about age, child or adult, where bruising is most common, your answer will be child. As compared to the child and adult, who get bruised most commonly, that is your child, my dear friends. Child skin, there will be you can say there will be more fat. Because of more fat, the skin is more flexible. That is why chances of getting tear is less as compared to the adult. So there will be a extravasation, there will be extravasation. This is one of the factors. Then sex, if we talk about female more than the male. Why female more than the male? The reason is very simple, that is subcutaneous fat. Subcutaneous fat. The reason is very simple, that is what, sir? Subcutaneous fat. Subcutaneous fat. Next, complexion. White people, white skin. White people, black. White people will get bruise more as compared to the black people. So these are the 4 important factors which influence the appearance of the contusion. What are the 4 factors? One is site, the bony prominence. For example, forehead. For example, your shin. For example, your elbow. Then coming to the age, child or adult. The child is most common. Then sex, female. Yes, female. More common than the male. Why? Subcutaneous fat is there. Then coming to the complexion, white more than the black. White more than the black, my dear friends. Now coming to the site. Site, bony prominence is more, loose skin more, thick skin less. If we tell about the bony prominence we have studied, other things you need to add here is loose skin has more. Loose skin has more as compared to the tight skin. Old age, loose skin more, that means old age. Thick skin less, young people less. Age, both child and elderly more. Elderly and child, old age we can say, child and elderly will have more. Then sex, female more bruise because soft skin is there. Then fair people more bruise because they are more visible, my dear friends. Then type of bruise we have to study right here, sir. Type of bruise, if we talk about ectopic bruise, which is also called as migratory bruise. Ectopic bruise is also called as migratory bruise. What do you mean by this ectopic bruise or migratory? Bruise seen away from the site of impact. If someone is hitting you here, bruise you will see here. If someone is hitting you here, bruise you will see right here. Away from the site of impact. And very important example right now we are having, sir. Number 1 is anterior cranial fossa fracture. So very beautiful example right here with us, sir. Sir, anterior cranial fossa fracture. Anterior cranial fossa fracture, the blood collected in the periorbital region. The periorbital region. This is periorbital region. Anterior cranial fossa fracture, you will see raccoon eye or panda eye. If I can tell you that anterior cranial fossa fracture, there will be a injury to the cribriform plate. Cribriform plate. This cribriform plate, there will be a, because of this cribriform plate damage, there will be a symptom, that is CSF rhinorrhea. CSF rhinorrhea means the CSF, which is colorless fluid coming from nose, coming out from nose, coming out from nose, coming out from nose. So anterior cranial fossa fracture, there will be a fracture to the anterior cranial fossa. The blood is collected in the periorbital region, my dear friends, where you will see raccoon eye or panda eye, and the sign and symptom would be what, sir? CSF rhinorrhea. Why? Because your cribriform plate is damaged. Cribriform plate is damaged. And from here only the optic nerve 1 is going, olfactory nerve is going. So there can be a symptoms like anosmia. Now second thing is middle cranial fossa fracture. In middle cranial fossa fracture, your blood is collected in the post-auricular or the mastoid surface. This is post-auricular or the mastoid surface, my dear friends, post-auricular. And here you will see the Battle sign. So in the middle cranial fossa fracture, the part which is getting fractured, the part getting fracture, petrous part. Petrous means hollow. petrous part of the temporal bone. Temporal bone. Petrous part of the temporal bone is gone. So you can see very well here where the site of impact in and where the bleeding is happening. So this is what called as what, sir, your ectopic bruise or migratory bruise. Now coming to the next type of bruising, that is pattern bruising, my dear friends. In pattern again there will be a 6 penny bruise, my dear friends, and this is seen in the manual strangulation. 6 penny bruise. Bruise is coming due to the fingerprint. You can very well see in this image, my dear friends, the bruises are coming because of the fingerprints right here, sir. The tip of the fingers when you are pressing somewhere, and if you are using the nails, then there will be a abrasion. That means epidermis is gone. Now the epidermis is not gone. Just there is a extravasation of the blood is there. Extravasation of the blood, that is just under the skin. There is a blood deposited because of the pressure we have applied there. This is nothing but a 6 penny bruise. Other bruise can also be there, my dear friends. The other bruise would be what, sir? Your butterfly bruise. Other bruise would be this produced in skin pinching also. Butterfly bruise can be seen in skin pinching also. Two things it can be. Skin pinching is a child abuse. You are doing like this, skin pinching. In skin pinching, butterfly bruise can come like this. Other thing is you are manually strangulating someone with this hand. This will also give you the butterfly pattern on the neck. In the skin pinch also, in the manual strangulation also, you are getting the butterfly bruise, my dear friends. Now the third topic is what, sir? Your artificial bruise. Artificial bruise is achieved by application of the plant juices.